Paul Offit, it took the apocalypse, RFK Jr. being appointed or recommended for Health and Human Services Director, for us to get to be together again since the pandemic. It's so great to have you back, brother.
Oh, it's so great to see you, Zubin. I missed you. Really miss you.
I missed you too. Really, I had this emotional reaction this morning when I knew I was going to interview you, because I'd reached out because, Vinay and I on our show have talked about this incoming administration and what's going to happen in healthcare. And there's good things that we back that we want them to do. But then this RFK thing, you and I kind of have this understanding of RFK Jr. that I think the public may not. And I think it's important that we kind of draw a line somewhere. We can say, okay, what is correct and what is really not a great thing. I mean, I'm understating the issue here, as far as my understanding, especially with RFK and vaccines. And so I thought of you, and I remembered how sane, rational, balanced, and humble you were during COVID, and how my audience really, really appreciated that, and I appreciated that. And I thought, boy, another chance to deploy the Paul-seeking truth missile is just brilliant. So welcome back.
Thanks for having me.
Let's start with this. I recently did a show with Dr. Prasad where I predicted that Trump would appoint Dr. Oz to a high-ranking position in healthcare government. And he did. What are your thoughts on our good friend Mehmet?
Actually, I like him. I mean, I've been on his show a couple times. He calls me periodically when he has questions about things. He's a little bit all over the place. I mean, on the one hand, for example, he was very much against the H1N1 swine flu vaccine when it came out. But then since then, he's promoted influenza vaccines. He has said that he's not sure. He's ambivalent about whether the measles, mumps, rubella vaccine causes autism. But then when there was a huge measles epidemic in this country around 2019, when we had 1,000 cases, he was a big proponent of measles vaccine because children were getting hospitalized. He promoted hydroxychloroquine, for an anti-malarial drug for the treatment of COVID, which clearly didn't work. And he's endorsed RFK Jr. And Joe McCullough, which has been hard to watch. And he's also argued for spacing vaccines out, the notion being that there are just too many too soon, and that's somehow overwhelming our immune system. So he's kind of all over the place.
Yeah, it's interesting. Since he was appointed, I've gotten dozens of text messages from people who've known me for years who are like, "Oh my God, your arch nemesis, the guy you've been crapping on for, over a decade, is now in this position of power." And you know what's funny? When it happened, because I'd been primed with RFK being appointed, it actually didn't bother me, because, like you said, Oz can be reasonable. Oz is medically trained. Oz has an academic background. Oz may be an opportunist and have a lot of ambition and all of that, but he's actually a clear thinker. So someone like that in a position of power doesn't frighten me. Now, let's contrast that. And people will be shocked to hear that, but I'm willing to talk to Dr. Oz. I think it's great that at least they've got a well-trained physician in a position like that. I think there's 100 other people I would have appointed sooner, but it's totally fine. But now, how do we contrast this? And I want to say, my audience in particular is very sympathetic to a lot of the things Bobby Kennedy says around ultra-processed foods, around conflict of interest in the pharmaceutical industry, around prevention of disease. So where are we? What are they missing here with this particular appointment?
All right, well, I'll start with the good news. I certainly agree that we can eat better, that we can eat better foods, that we can diet, exercise far better than we do. Not that I do any of those things, but I think it's a really good idea. And, because we do have, you would argue, an epidemic of obesity and type 2 diabetes, and the consequences of those disorders like strokes and heart attacks, we can be healthier. And if that's what he means by making America healthy again, I'm all for it. On the other hand, he's not going to be the guy to do this, I think, because he's a science denialist. And that's the nicest way I can say it. I mean, I first came in contact with him when he called me about 20 years ago. I think it was around 2004. And he said there were, and I wrote a Substack about this, which I posted a long time ago and then posted again recently, just because he became this guy again. where he said, there are parents who would come to my office. They're worried about this ethyl mercury containing preservative thimerosal that's in vaccines. As children were getting more and more vaccines, and some of those vaccines contain thimerosal, that he was worried that that could do harm, and the parents were worried. And what could I tell them? So this was around 2004. Now, thimerosal had largely been taken out of vaccines by around 2000, 2001, because I was on the advisory committee for immunization practice to the CDC around that time. So I remember that whole episode. And I think it was really an example of how not to communicate theoretical risks. That's what that was. I mean, the Public Health Service and the American Academy of Pediatrics put out a statement, which was true, but told you everything you needed to know. They said, all the evidence to date is that thimerosal at the level contained in vaccines is safe, but to make safe vaccines even safer, we're going to take it out. Well, if it's safe, taking it out make it safer. It just makes it perceived to be safer, which is different. I mean, Mercury is never going to sound good, right? It's not like there's the National Center for the Appreciation of Heavy Metals standing up in defense of mercury.
There's no recommended daily allowance of mercury on our cereal boxes, right?
But if you live on the Earth's crust, which we pretty much all do, mercury is in the Earth's crust in inorganic form. It comes to the surface via volcanoes or rock erosions, and then it's methylated, meaning it's taken up by bacteria in the soil or on the seas and methylated. So now it's organic mercury. It's not inorganic mercury anymore. And organic mercury can cross cell membranes, and certainly mercury at high levels can clearly do harm. I mean, there was an Iraqi fumigated grain disaster. There was a Minabon Bay disaster. These sort of corporate associated harms, which can harm people as well as certainly the unborn child. So that's not a question. The question is the point is there's no avoiding mercury. I mean, mercury is in anything that you drink that's made from water, which is everything. So mercury is in breast milk. It's in infant formulas. It's in everything you drink. So then the question becomes, is the quantity of mercury that was in vaccines, I mean, really prior to around 2000, 2001, was that harmful? This was actually easily studied. I mean, there were Western Europe basically took thimerosal preservatives out of vaccines and went to single-dose vials in the early 90s. There were Canadian provinces that used thimerosal-containing vaccines right next to provinces that used the same vaccines that didn't contain thimerosal, and then we took it out by 2000, 2001. So when he called me in 2004, there were a lot of studies to answer that question. I thought I'd answered them. I thought it was a really good conversation. I remember coming back to my wife that night and saying, this was great. I had a great conversation with RFK Jr. We're going to be throwing around the football at that compound anytime soon. Actually, I didn't think that, but
You're going to be at Hyannisport, just like chumming up with the Blue Bloods.
Oh, like the Kennedys did, right? No, just kidding. So in any case, I thought it was fun. Then, like in July of 2005, there was an article published in Rolling Stone called "Deadly Immunity," right, where he basically, this was really his entrance into the anti-vaccine world, RFK Jr., claiming that that mercury in vaccines caused harm, that it's present in vaccines at 187 times the actual level, that I was evil because I was associated with a pharmaceutical company, although I actually have never been associated with a pharmaceutical company in terms of any contract. I mean, I've always been funded by NIH or my hospital or the Wistar Institute. I'm not. I've never been funded by the pharmaceutical industry. But in any case, but I did work on a vaccine. I am the co-inventor of the rotavirus vaccine, the Rototech, a accomplishment of which I am proud. But so what he wrote in that article was that the reason that I defended thimerosal was because our vaccine was quote unquote laced with thimerosal, which of course is true of no live attenuated viral vaccine that contains preservatives. So I called up the editor of Rolling Stone and said, this is all wrong. This article is all wrong. And he sort of did that Ben Bradley, we stand by our reporter kind of thing. And it was really depressing. I mean, ultimately, they did withdraw the article because it was so inaccurate. But it was that. And I sort of became part of his stump speech. He would say, when he would go speak to, parent groups, he would say, I called the CDC and I said, who can I talk to about this? And they said that you can call Paul Offit. And I called this guy and he lied to me. And I'm thinking, he told me he would send me articles and he didn't. And people ask me for articles all the time. Of course I would have sent it to him. So I don't get that. In any case, he said he taped the conversation. Great. Release the tape. Let's hear it because this is not the way I remember the conversation. In any case, it was all very demoralizing because he sandbagged me. He lied. And I was very open-hearted to him. I believed him and I was wrong.
I don't know why this makes me like, it actually hits the emotion button for me because I know you, Paul. Like, I know what kind of human you are. And I know that you're telling the truth and you're earnest and you care about children. You care about adults. You care about truth. You care about communication. And I believe what you're saying. And you're right. If he had the tapes, we'd hear it. So what's going on with this particular human? Like what trauma has he had that this is how he operates? And everything that I've dug into. So in his book, the Fauci book that he put out recently, which is also full of nonsense, right? Which we can talk about. This is how I know he's a liar, because I know who I am. And he referred to me in the book, because vis-a-vis you, right, as a pharma troll. So first of all, I don't know what that means. Second of all, I'd love to be a pharma troll for money, but I've never been paid by pharma to troll anyone. So he just makes this ish up and puts it down like it's fact. And I don't know whether it's because he's unstable, he has an other agenda, he's trying for prominence. But from reading articles about how he was in college, when admittedly he was using a lot of substances and so on, this mindset of paranoia, people are trying to deceive me, conspiracy thinking, is not new for him. And if you listen to Carolyn Kennedy, his cousin, talk about him, the Australian ambassador, she said, listen, whatever he's saying now, we know his views for a long time, and they're dangerous with regards to vaccines. So this is not new. So that said, Paul, that was your initial thing. And then since then, with the Children's Defense Fund, which is his not-for-profit, he's gone around continuing to promote this idea that mercury is in the vaccines, that they cause autism, that there's too many, too quick, too much at once, all of that. What else has he said through that organization?
Right. So he recently he was on a Lex Friedman's podcast and was asked the question, is there any vaccine, this is recently, any vaccine that you think is of value? And he said, no. So that surprised Friedman. So Friedman followed it up with the question, well, how about the polio vaccine? Fair enough. I mean, RFK Jr. was born in the early 1950s, same time I was born, and certainly he got to watch polio in this country. We all did. And he said no regarding the polio vaccine. That vaccine killed more people than it saved. What is he talking about? I mean, and you're right. He still says vaccines cause autism when many studies have shown that it has. And he's an AIDS denialist. He doesn't think that HIV was the cause of AIDS. So, and more recently, he said, this was at a dinner in New York, he said that SARS-CoV-2 virus was created, engineered, which also, by the way, is not true. This was an animal to human spillover event that occurred in Stall A of the southwestern section of the Hunan wholesale seafood market that created two lineages of that virus that was either associated with bamboo rats or palm civets or raccoon dogs, because that was the DNA that was detected right there in the cages and the stuff used to kill the animals, to brush the animals, the carts, all there. And so the problem was, well, in any case, trying to kill all the animals in January 1st, that was the problem. They didn't do that with SARS-1. They still saw the animals, and it was very easy to go find those animals then and see that was a problem. But in any case, so it was engineered to specifically attack blacks and whites, but to spare Ashkenazi Jews and Chinese. First of all, I always thought I was white, but maybe I'm wrong.
So this is okay. This is really interesting because this is where this okay. There's several things here. One is the HIV denialism. That is an aberrancy in science denialism that we thought was gone, right? We now have somebody who's being proposed for Health and Human Services director who would deny that the virus that is targeted by antiretrovirals that have turned HIV from a death sentence into a chronic disease, a chronic illness that's managed often in marginalized populations or populations that don't have a lot of power or resource. Now the person who's being proposed to be in charge of this says, oh no, that's not even the cause of AIDS, and all of this science is wrong. That's basically what he's saying. Not a scientist. He's an environmental lawyer with the last name of Kennedy. So now why would people believe, why would people believe him and believe also the lab leak theory, right? Because I think, and this is the root of this misunderstanding, like where things have shifted, right? And you understand this too, because we were talking about this during COVID. The fact that during COVID, the elite scientific community appeared to be deaf to common human sense means that there must be some collusive effort of them to control us in some way. And that's the RFK pitch. Fauci is trying to, create a depopulation or whatever it is that he's saying. Instead of just saying scientists are scientists, they're not often great communicators. They may understand science, but they don't always understand policy or how actual human beings work. And so maybe we should look at that instead of throwing all of that out and saying it's all been a conspiracy to bioengineer this Chinese virus and kill everybody but Jews.
And Chinese.
Oh, and Chinese, right? Because the Chinese engineered it, so you have to spare. Yeah. We didn't see that didn't happen.
It's the lure of conspiracy. I think when a horrible thing happens, it's very seductive to go to a conspiracy. It is. I mean, when Princess Diana, died or something. I mean, it's the same thing. You're always looking for that conspiracy. Frankly, when Donald Trump was shot at, in Butler, Pennsylvania, you immediately think that there's something going on behind the scenes. And, when John F. Kennedy was killed, it's just, you're always looking for that conspiracy. And because first of all, you're not always wrong. I mean, sometimes.
Yeah, that's right.
But you're usually wrong. And that was certainly true. And it's the same thing. What he says regarding vaccines, he says he's going to get you the real information. He's going to find the real data because he's going to get to the real data. And then you'll understand it. He's going to interpret that data for you because you should trust him and no one else. And I mean, it's as if data are being hidden. I mean, when we, the FDA Vaccine Advisory Committee, sat down in December of 2020 to review Pfizer's vaccine and Moderna's vaccine. The way that works is that you get 200 pages from the company, their emergency use authorization. You get about 200 pages also from the FDA, which has reviewed all the data to make sure there's no omissions or misrepresentations. So you get 400 pages to read, basically a week before you meet to discuss each of those vaccines. So in that 2-week period, you read 800 pages of data. Those were all open to the public. You could read those studies. The problem, and I'm trying to figure out a nice way to say this, you would need some expertise to understand it. You would need to have some background in virology, immunology, statistics, epidemiology, which most people don't have. And frankly, most doctors don't have. I mean, that's why they look to expert advisory committees for advice. And I would argue we've done a pretty good job. I mean, what have vaccines done? They've caused us to live 30 years longer than we used to. Now, they're not perfect. I mean, anything that has a positive effect can have a negative effect. And sometimes you learn about it later. There is no hiding. Here's what I would say. If pharmaceutical companies were going to lie about vaccine safety, they're not going to be able to hide for long because look at the COVID vaccines. I mean, the mRNA vaccines were tested in 40,000 people, meaning 1-to-1 placebo. So really 20,000 got the vaccine. For the Pfizer vaccine, 15,000 got the vaccine. For the Moderna vaccine, that's 35,000 people. Now that's not a lot. I mean, I can tell you when we read those data, your heart is in your throat because you're making a recommendation for tens to hundreds of millions of people, and the other shoe is going to drop because it always does. You're going to find something that's rare, and you did with myocarditis. The rough estimate was about 1 in 50,000 for the mRNA vaccine, but for J&J's vaccine, the adenovirus vector vaccine, again, a rare side effect, 1 in 200,000 roughly with clotting, but severe clotting, including clotting in the brain, including fatal clotting in the brain that ultimately drove that vaccine off the market by May of 2023. Or maybe March of 2023, early 2023. So, and people look at that and they say, see, they don't know what they're doing. They're hiding data. But the opposite is true. I mean, I think we are open to the notion that there's more to learn here and that you learn as you go.
And I got to say, you were saying this from the very effing beginning, Paul, like when we were going through that data in real time during the pandemic, prior to it coming out, after it came out, you went through all this. You're like, our hearts and this is how it goes with vaccines. There's no subterfuge here. And you're working with FDA. You're not a total insider, but you're not an outsider. So you understand this stuff directly. So why would an American believe otherwise? What's the allure of conspiracy? And I'll tell you my thinking and you tell me what you think, because what I think is happening, first of all, is there's politicization. Like it just so happened that Republicans took up this thing, Democrats took up this thing. And after the vaccine came out, now you have Democrats in power. So there's a political spin always. But then on top of that, what you have is the failures of the pandemic communication and maybe some mistakes that were made that were never acknowledged properly at the time. So masking toddlers, closing schools for too long, locking down everything, ignoring sort of people who've already been infected as somebody who might have immunity, vaccine mandates for boosters. And this came with a kind of, since there was politicization and we had social media that created echo chambers, you have normally rational, sort of objective scientists who've now kind of weaponized their objectivity to make it subjective and say, tisk, 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 you bad conspiracy-minded, right-wing people, you're killing grandma and you're not doing the right thing and you're anti-science and trust the science and so on. And this group of people that are actually quite good people are now kind of traumatized because their livelihood is affected. They're being called stupid. Their political affiliation, which is part of a moral sort of tendency everybody has, is being questioned. And so what do? They go, well, in a way to kind of understand this, they drift to, well, this is somebody trying to control me. And the conspiracy becomes much more attractive. Plus, in the setting of not a lack of understanding, because we can't, like you said, you need an expertise to understand these studies. People will go to conspiracies because I can understand a Chinese-made super virus that was engineered by Fauci to depopulate the planet, or whatever the conspiracy of the choice is, pandemic, all that stuff, Judy Mikovits and all these guys. But they can't understand a 10-year PhD course that would be required to really dig into the nuance of the data. So to me, this is it's like a Greek tragedy for science, where science has hubris. They're confident that they know everything because they actually have a lot of knowledge. And then ate, which is the Greek for blindness. They don't see how to communicate it. And then nemesis, which is what I consider RFK Jr., the downfall of our clarity around science. So I'm just curious if you want to reflect on any of that or have your own opinions.
I think, having lived through it, I think there were pressures that were not handled the right way. So for example, in 2020, when that virus came into this country, I think the first reported death was at the end of May of 2020, but it may well occurred sort of the entrance of the virus before that. We had nothing. Right, we didn't have antivirals till October. We didn't have monoclonals till November. We didn't have vaccines till December. You had nothing. All you had for a virus that had unusual biological and clinical characteristics, all you had was avoid human-to-human contact for a virus that could be transmitted asymptomatically. And that was the big difference. That was the surprise. I mean, SARS-1 and MERS were fairly easily contained and really never caused a problem in this country because you transmitted that virus when you were sick. Here, you could transmit the virus when you were asymptomatic. So anybody you came in contact with on the street could kill you, theoretically. So that was number one. Number two is that when the vaccine came out, we did a pretty good job of immunizing roughly 70% of the population within 7 months. By July of 2021, we'd immunized 70% of the population, but we were overwhelmed by that virus. I mean, and I work at a children's hospital, I mean, which is going to be less fraught than a hospital that takes care of adults. We had 3 floors of COVID. And the big thing was MIS-C, this multi-system inflammatory disease, which is something I'd never seen before, meaning child gets COVID, has a relatively mild illness, 3 or 4 weeks goes by, and then they're fine, and then they come back with this recrudescence that's much worse. I mean, myocarditis occurred 50 to 75% of the time. Those kids were in the ICU. And our ICU was overwhelmed. And so what happened then is it was I'm trying to find a nice way to say it. It was galling that people would come into our house because by May of 2021, the vaccine was recommended for anybody over 12. So there would be adolescents who would come into our hospital sick, initially on the floor, face mask, oxygen, go up to the ICU and possibly be ventilated, who weren't vaccinated. And so it was upsetting that they were perfectly willing to let us take care of them, to burden us, but not do their part of getting a vaccine, because you were 12 times more likely to be hospitalized if you weren't vaccinated than vaccinated. So the public health community handled this by basically overpromising, I think overselling the vaccine a little bit, because we should have very early on said, because you knew it had to be true, this is a short incubation period mucosal infection like the virus I worked on, rotavirus, which can keep you out of the hospital, that vaccine, but it's not going to prevent you from having mild illness for long. So you knew that was true here, right? And that early trial that was done in December of 2020, which had like 95% efficacy against all manner of symptomatic illness, mild, moderate, or severe, looked amazingly good. But you knew at the time that 6 months later, that wasn't going to be true for mild disease, because antibodies in the circulation mediate protection against mild disease, and antibodies fade. So 6 months later, That's what you had. You had a lot of mild disease, and people thought, wait a second, I thought this was supposed to protect me. And worse, I was mandated to get it. And now I have a mild to moderate disease, which isn't trivial. I mean, it's not fun having mild to moderate illness. And so I think that probably the worst moment for me was when the CDC said they called those illnesses, asymptomatic or mild illnesses, breakthrough infections. Bad word. Applies to this wasn't a failure, and it was a success that should have been acknowledged as a success. I mean, the goal is to keep people out of the hospital. We were so upset that people weren't getting vaccinated. I think we tended to overpromise the vaccine. And then to me, the biggest mistake, I want to ask you a question actually about the notion of transparency, because the notion, the statement that's always made is that just have to be transparent. You want to gain trust, be transparent. I'm not so sure that's true. So early on, if you say at the beginning, look, we're going to mandate this vaccine because the degree to which, because the hospitals are being overwhelmed, and you're less likely to overwhelm the hospital if you got the vaccine. You shouldn't have to mandate. You shouldn't. I mean, I was an informed consumer. I mean, I read those 800 pages. You didn't have to mandate the vaccine for me. I couldn't wait to get that vaccine. I think if everybody read those 800 pages and understood them, they all would have gotten the vaccine. But nonetheless,
me too.
The people, when people say they did their research and they decided not to get the vaccine, which was what I heard a lot. What did doing your research mean? It meant looking on the internet and finding other people's opinions about the vaccines. That's what that meant, which isn't doing your research. Do the research, read all the studies that were out there. But in any case, I mean, the bivalent vaccine was another example of sort of overpromising. And I think, so let me ask you this question then, because this bothered me more than anything else during the whole pandemic. So Omicron comes into the US in December of 2021, right? A very different virus. I mean, 35 mutations in the spike protein, 15 in the receptor binding domain, which is the part of the virus that attaches itself. It didn't matter whether you were naturally infected or vaccinated. You were going to get Omicron because it was that different. But you were still protected against severe disease because T cells matter, and T cells recognize conformationally similar epitopes. Okay, so let's do this. Why are we still giving Wuhan 1? Let's include an Omicron variant. So that's what we did. Half dose Wuhan 1, half dose of one of the Omicron variants, BA4, BA5. That was not anything we were involved in. That was something that the FDA did in collaboration with the pharmaceutical industry. When we looked at those data, those immunological data, they were not impressive. So I was a Nova. No, I don't think this is any better than what we had. And then the data came out on immunogenicity, no better. Then the data came out on clinical data, no better. And no worse, but no better. And yet, there we were. I mean, Ashish Jha and Rochelle Walensky and Tony Fauci saying, this is better, you need to get it, includes the Omicron variants. And I called them each up and said, stop saying it's better. It's not better. It's not worse, but it's not better. You're losing credibility with scientists here at some level when you say it that way, when you say it's better when it's not better. But what if we'd been transparent? What if we'd said, look, we thought this was a good idea, this 2.5 dose thing, which we obviously don't do anymore. We thought this was a good idea, but we were wrong. And so we're not going to do this anymore. Does that make people think, thank you for being transparent with me? Or does it make them think these people don't know what the hell they're doing? Which?
What a great question. And I'll be honest, it's all in how that conversation is had. Like how and with who. Right. So at this time, like Rogan was having conversations with kooks like Malone and Peter McCullough, 3-hour in-depth conversations where they were allowed to spew total garbage nonsense that's been looked at bit by bit. Right. But did they have a conversation with Paul Offit, who was transparent throughout the pandemic? With everything that you were saying, you would say, I'm telling these guys this is what I think about Omicron. I remember we had the conversation, Paul, like, yeah, they're doing 50% Omicron, 50% Wuhan. Why? Because the pharmaceutical company is doing it. There's no good reason to do that. And that degree of openness. So all I can say, Paul, I don't know the answer. I don't know anything, but I will say this. When we would have our conversations the way we do now, which is transparent and honest and kind of fun, the people who watched would say, I didn't quite understand this and I was afraid of this until you guys had the conversation. Now I'm comfortable that at least smart people don't know everything, but they're making a recommendation for themselves. They're walking the walk themselves. And I think I'm comfortable doing it. So I heard so much of that, which is strange, Paul, because there's a militantism, right, in the science community sometimes about, don't brook any dissent. And I'm talking about like these science-based medicine guys and these guys. So they were at the time criticizing me for even talking to someone like a Vinay Prasad or someone because it wasn't an absolutist sort of stance, right? And now they're talking about like sane washing RFK, which I think is like not a good thing, right? But the idea then that we can't be transparent in that way, that we have to speak in a certain way in order to make sure people go along with it, I just don't know that. I think people are smarter than that if given the opportunity. So it depends on who and how, and I think those people are few and far between. That's the problem. They're far between they're more common in the anti-science sort of space than they are in the science space. But I think, like all these guys had really good intention too. And when you talk about it this way, when you're talking about seeing people die and on ventilators, kids in the ICU, people need to feel that emotionally. And when you talk about it, they feel it emotionally. But I think so much of this was just, again, it's that Greek tragedy of they're right scientifically and they wreck it through how they communicate it. But again, that's because I'm in this space and this is like a passion of mine. I don't know. It's been traumatic, I think, for so many people. It's been traumatic for me to see this. I know it's been traumatic for you. This is why you spend so much of your time going on the news and saying, I need to talk about this. This is why I wanted to talk to you about RFK, because honestly, it was a little, and people will say, oh, the pearl clutching when Trump makes a recommendation. I think that's all fine. Like Oz, if I'm fine with Dr. Oz, like that says that I'm not clutching my pearls. I'm clutching my pearls about RFK because he's just a different level of denialist and dangerous, honestly, because it will erode the public's trust and faith in the actual process of science. Forget about the communicators, forget about you and me, the process of science.
No, I couldn't agree more. I think I've been interviewed by every major news source over the last 2 years, 2 weeks since he's been mentioned for this post. But one reporter, I think it was Rolling Stone reporter, said to me, "Don't you think that if RFK Jr. is given the position of Secretary of Health and Human Services, that people will lose trust?" And my answer to that was, I think the opposite's true. I think because people have lost trust, he becomes more viable, because that's what he says. He says, we can't trust these people. We can't trust the public health people because they've been lying to us, and I'm going to get to the bottom of this. And it just really, really upsets me. I think that this is going to be a major hit for the public health service. And as invariably true, when that happens, it's going to be the most vulnerable among us who suffer, and that will be children. I mean, you're already seeing it. I get emails now from pediatricians saying, I've had parents come into my office and say they're not getting any vaccines. I've never seen this before. And they're pointing to Robert F. Kennedy Jr. Now, he's always had a platform because he's a famous name, but his now that he's even being considered for something like that, I think validates his false concerns about vaccines. And it really worries me because, and measles is what worries me, because measles is the most contagious disease. It's going to come roaring back, and it's going to be a problem.
So tell us, make this tangible for us. Tell us about the Samoan measles outbreak and RFK's role in that, because this to me brings it home, the danger that's involved here.
Right. So Samoa, the measles, mumps, rubella vaccine that goes to Samoa is in powdered form. So unlike here, so it needs to be reconstituted in like sterile distilled water. Two separate nurses each made the same mistake. Instead of reconstituting it in sterile water, they reconstituted it in a muscle relaxant. They gave it to children who were roughly 12 months of age, who immediately stopped breathing and died. It was a nursing error, a terrible, terrible nursing error. But RFK Jr. and his Children's Health Defense seized on this, and in his Facebook posts over and over again, he said, measles vaccine is killing children in Samoa. He went to Samoa. He met with anti-vaccine activists. I think her name was Winter Green or Winter Garden, something like that. Karen Winter Garden, I think, who was an anti-vaccine activist. And other anti-vaccine activists in Samoa. He met with the president of Samoa, premier or president of Samoa. And he, because of his lobbying effort, immunization rates dropped to about 30%.
Wow.
So that was 2018. So 2019, massive epidemic, 5,600 cases, 83 deaths. Most of those deaths occurred in children, healthy children, less than 4 years of age. He was directly responsible for that. I'm sorry. And the thing that tells you everything you need to know about RFK Jr. was how he responded to that. The way he responded to that was to say, first of all, he said, I didn't say don't get a vaccine. No, you just said the vaccine was killing people, which I think is a way of saying they shouldn't get the vaccine. And then he said that that those children didn't die from measles. They died from measles vaccine. What are you talking
Oh
about?
my.
We can never admit that he's wrong. There's a movie called A Shot in the Arm by Scott
Yes.
Kennedy.
Hmm.
Yeah. So he interviews RFK Jr. in that. You can see him sort of, trying to worm his way out of it. So he never admits he's wrong, which is not somebody you want in a position where you're supervising science-based agencies. I mean, you learn as you go. We make mistakes. We learn as we go. But God knows you have to be open-minded to it. That's the beauty of science, which is that it's invariably self-correcting. That you can take a textbook and throw it over your shoulder without a backward glance as you learn more information. I learned things as a pediatric resident that were wrong about, like, that after a child, baby ingests food, that that you lie them on their stomach so that they won't vomit the food back into the windpipe. But then that increased the risk of sudden death syndrome. So in the early 90s, after I trained, you came the pediatric AAP's back to sleep program, right, to put kids on their back, and that dramatically lowered the incidence of sudden infant death syndrome. But that was taught to me as if it was gospel, and it was wrong.
And taught to me was that opioids are essential for pain and that we're undertreating pain and so on. And now we have an opioid epidemic. So yes, and it's self-correcting because now it's being corrected. Okay, what you said about the Samoan thing, this is the danger of a guy like this. People have said, I've talked to a lot of people, they're like, nah, he says now he's okay with vaccines. He's a liar. And when he says, he's a liar. When he says I'm not anti-vaccine, he's lying. He just said on shot in the arm or dark that particular documentary, a shot in the arm. He's saying there's no vaccine that I think is okay. And you said he said that. So how is that not anti-vaccine? Like I think you told me off camera, if he's not anti-vaccine, no one is anti-vaccine. So it's absurd. Now, here's the thing. I want to just say this because I know a lot of good, smart, intelligent, caring people are really compelled by him. He's a Kennedy. He's saying good things about other stuff. And he's a fucking liar and a manipulator. So it's not your fault if you believe this, if you're drawn to him, if you think you're being a good person by listening to him, right? It is your fault if when doing the due diligence and you're listening to other people you trust, you don't shift your opinion on him. Then you're culpable for this because he is going to wreck. Look at HIV population. Are we not going to promote prophylactic treatment for HIV now? Like, how many people will die because he is pulling the strings of HHS? So this is why it's so important. This is why we get passionate about it. And listen, I'll say another thing. Like, I'm a skeptic of some of the science now. I think, like you said, Paul, some of the stuff we do is still yet to be proven wrong and will be. But that's why you do the science. You don't throw it all away.
The other thing he argues for is raw milk. He thinks we should drink raw milk. And my attitude on that is, if an adult wants to drink raw milk and going in with their eyes open, that there's an advantage to pasteurization, which was done in like 1860, because that's fine. But know that by not pasteurizing it, you are putting yourself at some risk for salmonella, Campylobacter, E. coli, listeria. But don't give it to children because they can't make that choice. You're making that choice for them. And we certainly see children come into our emergency department who suffer those diseases because of that choice.
Yes, and this idea that, first of all, it's not as safe as pasteurized milk. That's 100% true. I've taken care of a patient I remember who had an endocarditis due to raw milk ingestion. It was a particular bacteria, which I don't remember. It was back in residency, but it was so clear. He was one of these crunchy granola people who would listen to guys like RFK Jr. saying that there are health benefits to raw milk, right? And would end up in the ICU had to have a valve replacement. So this is not innocuous. And you're right. The children are most vulnerable are the ones who are going to suffer, someone with immune compromise, et cetera. What do you think about something more potentially benign, like fluoridation in water, where he's talking about removing fluoridation in systems of water?
Right. So fluoridation certainly did decrease the incidence of cavities. No doubt about it. I mean, in that it was a public health treatment. There are sort of levels. See, you shouldn't ask me because I'm not a toxicologist, but I'll just tell you what I've read. It's not really but there are levels above which you shouldn't try and that you shouldn't exceed. And then you could argue there's other sources of fluoride. But in any case, that certainly worked. It certainly worked. And what I say sometimes is when Donald Trump said drill, 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 everybody thought he was talking about oil. He was really talking about children's teeth. No.
He's paid off by the American Dental Association. Yeah.
But so,
you're in
so
big tooth's pocket, Paul. Yeah.
But again, so he sort of points to this one study, which was not a great study, looking at how like there was a change in IQ of 2 to 3 points based on a certain level that's generally higher than what we have. And I mean, if that's the reason we're taking it, but see, my theory on these things, fine. You want to reevaluate fluoride in water, fine. But let's do it with good science, accurate science, instead of him doing it, because I don't trust him to get the science right, because he so often gets the science wrong. There's one thing he does, by the way, that particularly bothers me. He did this on Rogan's show. He was talking about Thimerosal. He says, there was a study done in monkeys by Thomas Burbach. And what Burbacher did was he inoculated infant monkeys with the same level based on weight that a child would get, these thimerosal containing vaccines. And what you found was that you could detect ethyl mercury in the brain, which is not surprising because it's organic and can cross cell membranes. And that they saw, quote, the greatest level of inflammation that they've ever seen. Because it always has to be described that way, right? I've never seen inflammation like that. Usually scientists don't talk like that, but that's what he said, right? Read the paper. It doesn't say that at all. It says there was no inflammation. So just because he knows you're not going to read the paper. He knows no one can read that paper, which is a relatively obscure paper. You have trouble finding it. And that's what bothers me the most. He lied.
So this is where people will say, debate him. But what he'll do in a debate is he will snow you with all this bullshit. That's a great example. He'll say this, and then it will take you don't even have time in real time to respond to the thousands of terrible studies that he's citing with all kinds of misrepresentation of even what the study says, even though the study itself is in some pay to publish journal. So this is why scientists are on the back foot always when it comes to folks like this. And, another thing I want to say, and I think this is something that's come to me recently, and I could be wrong, but I'm curious what you think. So there was recently an article in The Atlantic by David Brooks, and it was about, I think the title was How the Ivy League Broke America. And I think there's a lot of truth here. It's a long article, but I'll give you the punchline. The punchline was that, in the early 20th century, the big Ivy League schools, Princeton, Yale, Harvard, et cetera, they only accepted people based on lineage, on breeding, the sort of blue bloods, the well-bred man, white man from a Mayflower family who was selected for athleticism, looks, poise, social grace, these kind of things. And the big competitive things in those schools were getting into Skull and Bones and the social societies. And they would look down on the nerds, right? Like you and me. They would be like, oh, that's the grind, Buffy. We don't want anything to do with the grind. And those were the people that became president up until the 1950s. And so there was this feeling then around the 1950s that, maybe this should be more in the service of society, in the service of a meritocracy. So one of the presidents of the Ivy League school said, we're going to start screening on IQ and merit. So we're going to have standardized testing, grades. We're going to screen on academics, and we're going to let go of legacy some more, let go of this sort of breeding idea. And that way we'll have an elite class of that runs the country that's actually based on their ability, heaven forbid. So now you start having this intellectual class that's screened based on innate intelligence. But the kind of intelligence you can test for, not the kind of intelligence that actually leads to great leadership and so on. So now you have these low EQ, high IQ people that are screened for, and their parents who are also screened for that are perpetuating a system of torture for the kids where they're not allowed to be creative. They have to teach to the test, get into school, pay all this money for violin lessons and tennis lessons and private tutors so they can go to an Ivy League school and continue to have a chance in a job market that will only take people from the best schools. So you perpetuate an elite class that is increasingly dismissive of others who don't have that education or weren't born with IQ. And it creates a kind of social disparity. And the thing is, they didn't do a great job. So we get into Vietnam, we get into, the communication around COVID and all of that. And so then the rest of the population that doesn't have this advantage or is feeling onerously pushed by it start to push back and go, we're going to elect a guy like Trump who speaks anti-intellectually, who has an open disdain for science as it's practiced currently, and is kind of one of the old school blue bloods, came from money and so on. We want to go back to that. And I totally get it as one of the elites. I totally get it. Sometimes I don't trust myself. I look at my poor children that they're trying to get into college, and it breaks my heart because all she wants to do is play music and paint art. And we're like, but what about your grades in science? And it's so, I don't know, Paul, hopefully there's some shift coming where we can come to a balance, but I'm curious what you think as a father too.
Yeah, I am stunned by the way things are going now. I just feel sort of this sense of hopelessness that we have created such distrust in the a system that was trying to do a good job. And I can understand how people felt we were overreaching, that there was a real government overreach there. This isn't exactly your question, but I'm just lamenting where we currently are. But let me give you another example, just because I want to see how you would have handled this. In February of 2022, I was asked with 3 other immunology virology types to participate in a conference call about whether or not natural infection should count as a vaccine. In other words, that for those areas that were still mandating vaccine, which was many in early 2022, whether they should be able to say, look, here, I was naturally infected here. This should serve as my vaccine card. And that meeting was held with Rochelle Walensky, Tony Fauci, Vivek Murthy from Surgeon General's office, and Francis Collins, and then me and 3 other immunology virology types. And what was funny about that meeting was Vivek Murthy, who could not be a nicer guy, sort of started.
He's a sweetie. He's a friend of mine. I can't say a bad word about him, even if I disagree with something he's done. He's such a sweetie. Yeah.
So he started off. He said, "Oh, let's introduce ourselves." So, Tony Fauci says, I'm Dr. Tony Fauci from NIID. And then Rochelle Walensky says, I'm Rochelle Walensky from CDC. I said, we know who you are. And the question is, who the hell are we, right? Yeah, Tony didn't need to introduce himself. In any case, so we voted on it, and it was sort of 2-2, basically. I mean, I was one of I think natural infection should count for obvious reasons. I mean, actually, you're making an immune response to all 4 viral proteins. You, in many ways, make a broader cytotoxic T-cell response. I think you're better off in many ways. The problem with natural infection is it's misnamed. It should be called survivor-induced immunity because not everybody lives with a natural infection. So,
yeah,
that was. I wish we had then immediately gone to the press and said, look, here's the conversation we just had. Here's the conversation that we went back and forth on this. Because while we all basically agreed, I think that it should count, that the question was bureaucratically, would it work at a time when people could just go on the internet and say, look, I've been naturally infected and get out of it. It's just, it became more of a bureaucratic issue. And the same thing actually with this, sorry, I'm just ranting on COVID because—
No, keep going.
But there was, so we now do something only one other country does, which is we recommend a yearly vaccine for everybody over 6 months of age, a yearly COVID vaccine for everybody over 6 months of age. Canada is the only other country that does that. Western European countries, Australia, the World Health Organization, Scandinavian countries, all target high-risk groups, right? Because the goal of the vaccine is to keep you out of the hospital. Who's getting hospitalized? People who are over 75, which I'm not quite there yet, so that's good. I'm not technically elderly yet. People who are receiving immunosuppressive medicines, people who have chronic health conditions, and people who are pregnant. So those are the highest risk groups, and unvaccinated youngsters, by the way, too. Just so we're clear, I think this is somewhere where I disagree with some of the people who you just mentioned. Children should be vaccinated. They should, because they represent like 5.8. Children less than 4 represent 5.8% of emergency department visits because they get bronchiolitis and croup. I mean, it makes you sick, and the vaccine doesn't make you sick. So, at least not in any important way. So, yeah. So in any case, we so we're different than these other countries. So I saw Dr. Fauci at a meeting maybe a year ago or so, because I was already getting out there saying I think we should target high-risk groups, where I was getting a lot of pushback from public health people who felt that I had gotten off the bus. Because, see, that was the whole feeling in this. You're either on the bus or off the bus, and there was no in between. So I'd gotten off the bus. I said, Tony, am I wrong? Am I wrong in making? He said, no, you're right. We should target high-risk groups. He said, the problem is, the minute you say that, it becomes a nuanced message. And a nuanced message is a garbled message. If you really want to make sure those groups get vaccinated, then you recommend it for everybody. And okay, so if we think that, we should say it. Because my personal thinking on this is, then if that's the reason we're vaccinating healthy 16-year-old boys, that's not a good reason. And just have it open. Say it openly. You know what I'm saying? Because I think people are smart enough to hear it.
Paul. Okay, first of all, this is why I love you. This is why everyone watching should trust you when you talk about these things, because you see so clearly. I agree. I think one of the biggest tragedies in this Greek tragedy is good people making the wrong communication decisions. So this idea that, and this goes back to the David Brooks article on how the Ivy Leagues broke America. There's a thinking among the elite that they know what the common person needs. They may know scientifically, but they don't know here how to communicate. Like, okay, let me be honest. I would even be honest, right, Paul, like what you just said, and you did say that actually at the time, I think, of my show. Like, listen, we're going to make this recommendation. The reason we're saying it this way is there's going to be confusion, but here's the truth, okay? Natural survivor-based immunity is going to give you, and so many people at the time were emailing me, these people don't know what they're doing. Of course I have antibodies, but now they're mandating me to get another dose, which is going to give me 2 days of symptoms that feel miserable and with no benefit. And also I don't want to do anything to myself I don't need to do. So why is this happening? Oh, because the good of the many outweigh the good of the few. Come on, that's not how they feel it. Everyone sees it as a single issue, single person problem. So you're absolutely right. And by the way, I want to thank you. I'm so grateful to you for everything that you've done during this and for children for all your entire life. Like you're one of the people that I know that I feel so deeply privileged to know and to have been able to connect with in this life. So no matter what else happens in the future, if everything goes to hell because, whatever RFK is doing, I think the universe is a better place overall net, because of people like you, Paul, and your honesty. So yes, I think you.
I feel the same way, by the way, about you. Thank you. I really appreciate that.
And both of us occasionally step off the bus of whatever it is our tribe wants to do. And I think that's important. And it's important still not to disown your tribe because of it, right? I think some people, friends of mine, they maybe go a little too far in disowning their own tribe, because this isn't a tribal thing. This is a human thing. My hope is that we're finding understanding wherever we can. We're looking for truth, but we're also looking to understand each other when we don't understand truth. Like, why is that? I think that's as important as getting to the truth because it's part of the whole expression. Man, that was a lot.
I do think one thing that also there's this notion that there is a financial conflict, it certainly doesn't look good. I think that the companies pay essentially the FDA to have their product reviewed. And often when we have our discussions, the companies are often referred to as the client, which doesn't feel good either.
Doesn't feel good.
But I would only argue, I don't see any evidence, at least in the vaccine world, that it matters. I really don't. I think the people that give advice, first of all, you can't be on these advisory committees if you have any connection to the pharmaceutical industry or any connection to the government. You can't. I mean, when I'm asked to give a talk occasionally, and if it's like a company sponsored event, I don't get it. They can't pay for anything. They can't give me water. They can't give me lunch, nothing, right? Because you should see the forms you need to fill out every time we meet with these FDA vaccine advisory committees. You can have no association with you. Fine. I think that's fine. So because I do, my sense of watching the process up close is that I think it's fair. I don't think it matters, but it's very easy to see how people can be seduced into the fact that it would matter. I just don't. If they're going to say that, show clear evidence where that's true. Is all I'm saying.
Yeah, I think that's good. I think show clear evidence. I think it's worth looking at that and saying, okay, is it actually a bias? Because so much of what we do, Paul, is unconscious. It's really unconsciously motivated by causes and conditions like past relationships with pharmaceutical companies, whatever it is. And so it's good to kind of look at that. But that said, like, for example, like, why are we saying yearly vaccine in this country when there isn't great data, like you said? And so the common person will say, and some uncommon people, very smart people will say, look, there's a financial incentive to keep giving vaccines because otherwise, and you and I have talked about, well, COVID is not like flu. It's not something that you need a yearly vaccine for unless you're high risk, like you said. So of course people will jump to, well, this is a financial conflict. So I think this is what I think, Paul, like, again, in the terms of transparency, like what you just said. Okay, so this is Paul's take on that. Here's Vinay's take on that. So let's talk about that and see if there's a study we can do or something. That's how we should do it. But I think when there's darkness around it, humans will immediately jump to, well, what would I do in that situation? Well, I'd want money. Or, what's the common root of all evil? Money. And so they go right to that because that's something that everybody knows or thinks they know. They don't understand the nuance of how these committees work and how you have to disclose and so on.
Yeah, the one other sense where I'm burdening, which saves me a trip to a psychiatrist, so I appreciate it. Because you mentioned both these people earlier, and I think it sort of gets the central point. When RFK Jr. says something, I mean, he's a lawyer, so he doesn't, at some level, at least to some, he lacks credibility. I think same thing's true with Marjorie Taylor Greene, which she sort of says that, she thinks vaccines cause cancer. I think people just, put it with the same space as, Jewish lasers are causing California wildfires, that sort of space. But Robert Malone or Peter McCullough aren't those people. Robert Malone is a brilliant man. He was a brilliant researcher. He did work in the late 1980s, publishing 2 papers in Proceedings of National Academy of Sciences that were seminal to mRNA research. He could reasonably have won the Nobel Prize. Really, it was that good. The stuff that he did was that much of a breakthrough. It was like 89, 90, somewhere in there. And Drew Weissman, who did win the Nobel Prize, and I think I've introduced him 3 times in the last 2 weeks. It's like every time I have to say he won the Nobel Prize. I won a prize too. Okay, I won this little baseball prize when I was 8. Do I go touting that around all the time? No. In any case,
Paul, can I interrupt for a second? I won a prize too from a group you're affiliated with, and it showed up at my house, but it had a typo, and it was supposed to say Public Health Educator Award, and it said Pubic Health Educator Award.
I got the same thing. I got the same thing. It said pubic on mine too. I got 2 of them. I still have it.
I mean, that's an award like Puff Daddy would win, not something I would necessarily win. So sorry, back to you, Pubic Health Educator.
So and same
Drew
with
Weissman.
McCullough's a cardiologist. I think he was chief of cardiologists at Belmont Hospital or something. So those are the people I worry about because they're credentialed. Or Joseph Ledeppo, from Florida. I mean, he's an MD, PhD from Harvard, and he sends a missive out to all these healthcare workers in Florida saying that as what Robert Malone said also, that that the mRNA vaccines are contaminated with fragments of DNA, which can then enter your nucleus and enter your DNA and cause you to have cancer and autoimmune disease, which is utter nonsense. I mean, anything made from cells, like the measles vaccine, the mumps vaccine, the rubella vaccine, the varicella vaccine, the rotavirus vaccine, all will have small fragments of DNA. It's unavoidable. The Novavax vaccine, same thing. And assuming you live on this planet, which we all do, and assuming you eat anything made from vegetables and animals on this planet, which we all do, you will have foreign DNA in your circulation, which when it enters your cytoplasm is quickly recognized as foreign and destroyed. Also, it doesn't have a nuclear access signal, and it doesn't have an integrase. There's 0 chance it could actually affect your DNA. Also, the other thing I don't understand is why can't it affect your DNA for the positive? Why do people always assume it's bad? Why can't you develop superpowers?
This has been my take. Like Malone, it's like, okay, Malone, so this is going to integrate into your DNA. Well, now I have laser vision because I have Jewish laser vision that starts wildfires, actually. No, but actually your point here is important because expertise, we should question, of course, like credentials and so on. It is important. But so you have someone hyper-credentialed. That doesn't mean they're not delusional. It doesn't mean they haven't made a mistake. Because especially when they're an outlier, they could be the first and a vanguard of a new way of thinking. Absolutely. Like that's happened. Semmelweis. We can give tons of examples of people that were rogues at the time who died in obscurity, who turned out to be, right. However, in this case, you can kind of look scientifically at these arguments and go, these are highly credentialed people who are suffering from some kind of deep misunderstanding or delusion, or they're just wrong in their predictions or understanding of this. And that can have that you can debate. You can sit down and go, yeah, and that's been done. Like you can go through and Robert Malone's claims and go, just not, no, while still saying, like you just did, tremendous researcher in the past, like huge contributions to the field. Like you don't have to ad hominem him, right? I tend to use ad hominems because I'm just an asshole, but like, I don't think you do. Like, I think in general, we can have these conversations, but again, if people are morally or they're unconscious inclined to that belief, they're going to pull and cherry pick those particular experts out and say, look, see, this is what so-and-so says about this. That's where the gray area of Dr. Oz comes in, because Oz kind of is a populist in a way. He's looking for what people are interested in. And so in a sense, because he has so many credentials, he can mislead people. And that was my big criticism of him when he had a show. I'm hoping now that he's going to be basically stuck with the worst effing job on the planet, which is managing Medicare and Medicaid, that he'll actually become more of a technocrat. But we'll see what happens.
Right. Yeah, no, I think Pogo, the lovable possum that was created like in the 1940s, said it best. I have seen the enemy and they are us. True. And we have to distinguish that. I mean, first of all, there's something called Nobel Prize disease. It actually has a website, which goes through these Nobel Prize winners who did remarkable work and then, made idiots of themselves doing other things. Like Luc Montagnier, right? The man who discovered, along with Bob Gallo, that HIV was the cause of AIDS, then set up a clinic in Southeast Asia to treat children with autism with antibiotics because they thought that would work. Believe it or not.
Or Linus Pauling's vitamin C crusade. Honestly, Paul, can I say something? The energy, we've seen the enemy and he is us. So recently I've been doing a lot of this like kind of inward work and looking at my own unconscious shadow and all this. And it's part of the whole, nonsense that I do now, kind of awakening stuff. What I've noticed is we're blind to our own conditioning until we see it. And then we see what's driving us. And once we do, like, if you, me, Peter Malone, Robert Malone, Peter McCullough sat in an emotion circle work group and went through the deepest stuff that's traumatized us, I suspect we'd see, you know what? No wonder I'm so fixated on mRNA vaccines. I really was snubbed for the recognition that I deserved at that time. And I'm hurt. And the inner child that was hurt by that can't stand it and needs to go out and prove that I'm still important and still a contributor. Whereas if he really looked in, he'd be like, of course I contributed. Of course I'm important. Of course I meant well. Of course I'm a good person. But that work is never done. It's always the work of avoiding that by going out in the world and projecting something you want to see based on unconscious things that you won't look at. So that's my soapbox. But
yeah, you should see one thing since we've mentioned it.
Ooh, now I hope this has nothing to do with pubic health education because
No.
That is not okay.
That baseball award I told you about. See that?
Oh, wow.
See,
that's adorable. How old were you?
1959, P. Offit. That's when you could use words like midgets to describe baseball leagues. But that's it. So he wins the Nobel Prize, but I won this. Okay. Maybe we're even.
You know what you've won is you've won at life, Paul. I remember one of my fondest memories of you is I won't give anything away, but we were the first time I ever interviewed you, and remember those vaccine activists showed up at the door. And by the way, I have to say this. I was so reactive in those days and so like, I'm right and everyone, these guys are wrong, that when these people came to the door and they'd lost a child and they blamed it on vaccines, but they'd still lost a child. I didn't know any of that when they were doing that. The way I reacted was so unconscious and non-compassionate, even though I disagreed with what they were saying and so on. And they were basically violating our physical space and trespassing and all that. The way that I dealt with it was not how I would deal with it now, right? I would look to understand rather than to think that I know. But after that, I drove you to the airport or back to your hotel or something. And I remember we had this conversation and you kind of showed me who you are. It was just like, oh, wow. Like, you know who you are. You know what you know and don't know. You're humble and you care about people and you get hurt when people actually don't see that, because we all do. And I think it was so beautiful that I swore at that point, I'm like, anything Paul Offit wants from me as a platform, he will always have, because I trust you in that way, that it's very hard to find trust in a human. So I so deeply appreciate that, Paul.
That's very nice. And obviously it's very hard to remain humble after you win.
I mean, you've hit the pinnacle, man. Like, that's like a BAFTA or an Emmy. It's bigger than that. Do you still play any sports?
No. Well, my wife golfs and she tries to get me to golf, but I used to be a decent golfer, but I just don't do that anymore. I figure I have other ways to frustrate myself.
There you go. And what's next for you?
So I'm actually working on another book, the next book. My last book was Tell Me When It's Over. Sort of was just cathartic for me to write about the things that I think went right and went wrong, which we've talked about here. The next book is right now, it's called actually The Nobel Prize Deception. And I think the subtitle is going to be something like how or who to trust. Who can we trust when experts give us bad advice?
Oh, wow, man. That is amazing. Will you promise to come on my show to talk about that, because this is fascinating to me.
Happy to.
Yeah. See, I have this mantra that a friend taught me, which is never underestimate the forces of delusion. The smarter you are, the more easy you can self-deceive yourself that you know everything. And I've noticed this. So the Dunning-Kruger effect too is real as well. So anything else you want to talk about, Paul?
No, I think we covered the earth there. That was really fun. Thank you.
Me too, brother. Me too. Like I've been sitting on this kind of thing. Like, how do I talk about this? And I just have found the perfect way. So I'm really grateful to you. So
I'll say one thing. One thing that really worries me is I do feel like with RFK Jr. sort of ascending into this potential position as Secretary of HHS, I feel like it's that science is losing its place as a source of truth, that people simply declare their own truths, including scientific truths. And it does worry me. I mean, it's like there's this old W.H. Auden poem, which is something like, when all the mass and majesty of the world, when all that carried weight always weighed the same, lay in the hands of others. And that's what I feel this is. I feel like, what always carried weight and weighed the same now isn't being judged in the same way. You can just declare your own scientific truths. And I really worry about how that's going to affect our country.
I agree with you, and I think with everything, it's like a transcend and include. So science isn't perfect. It can't answer the mystical, deepest truths of humanity, but it does a damn good job at what it does in this relative world. And to reject it because it's not perfect is not it. It's to keep trying to perfect it, to keep that process going, and to also learn how to understand each other. I think that's a science that we haven't explored enough, and I think is probably the next phase of all of this. So yes, and thank you for doing your part in that crusade. And also, I want to acknowledge how hard it must be for someone like yourself who spent a lifetime dedicated to this, to see this emerge in the world as a reaction to a fight that actually you didn't cause. You were on the right side of the communication of this. So maybe by your continued existence in this space, you can nudge other people in the scientific community to communicate more clearly and with heart, which is what comes out through everything you say.
Yeah, two quick stories to end it. When Maurice Hilleman was in many ways the father of modern vaccines. He developed 9 of the 14 vaccines. He either did the primary research or development of 9 of the 14 vaccines we give to children. He was diagnosed with disseminated cancer in October of 2004 and died 6 months later. But this was like 2004, 2005. So we'd eliminated measles by the year 2000. But it had come back in large part because of the Andrew Wakefield paper that claimed MMR caused autism. So he was starting to see an erosion in immunization rates. He was starting to see measles come back. And I wrote a book about him called Vaccinated. But in interviewing him for that book, I said to him, and I remember this day, it was January, it was snowing outside, and I was at his office. I said, okay, now these diseases are coming back a little bit. Do you think we can educate people so that once again, children aren't going to have to suffer? Or the only way people are going to realize the importance of these diseases is to watch children suffer? And he spent a long time answering that question. He was staring out the back window, and then he turned back towards me and a little misty. And this was not a guy he grew up in like rural Montana, was in the Army. This was not a guy that cried, but he clearly was affected by that. And he said, nope. I think the only way we're going to really be able to realize how important these vaccines are is to watch children once again suffer. That's what he said. Hope he's wrong. So that's the bad news. The good news is I sort of try and reassure myself with this story. So even though you have to go back to the 1600s to make yourself feel better, but there was Galileo, right, observed planetary movements, and he came to realize that actually the Earth revolved around the sun, that the Earth was not the center of the firmament as defined by the biblical scriptures. So he was brought up before a Roman tribunal and censured for that belief that they saw as blasphemous. So he was shackled, put in chains, he's being let out. But before he leaves, he turns back, he looks at the tribunal, he says, presumably in Italian, and yet it still moves. Meaning, you can put me in chains, but the Earth still revolves around the sun. And that's what I feel about this. I think RFK Jr. can say vaccines cause autism all he wants, but the fact is they don't. And that'll matter.
Yeah. So ultimately, this is something that I've come to learn in any spiritual practice or scientific practice. Truth is, and delusion isn't. It's just as simple as that. So ultimately, whether there's a movement towards truth or not depends on us, but delusion just simply isn't. It just isn't. So we can say it all we want, but it doesn't make it true.
Right.
Paul, what a joy. I'm so, it always takes some cataclysm to bring us together. First, it was a pandemic. Now it's RFK Jr. I will equate the two. I will, people who are watching this or listening to this, please, leave your own thoughts and comments, and be polite, be thoughtful, be open. If you disagree, go ahead and put that in here and put sources and link to things. But you know how these things go. We're not going to be able to respond to all these comments. Yeah. But at least we hear everybody's voice and we get a better sense of how to communicate.
Yeah. I always just settle for not getting death threats. I have a very low bar for this.
Yeah, that's true. For Paul, it's like no death threats for a week. This has been a good week. Yeah, it's really true. And by the way, RFK Jr. is responsible for probably the vast majority of those death threats. So that's another thing. If you guys,
and one of them, right, just not that long ago, somebody, I got doxxed. I guess I was on some, it was called Telegram. Is that familiar to you?
Yeah. Mm-hmm. Yeah.
So I was on the top of top 100 Jewish people targeted for extermination. That was what the list was. And
wow,
you want to be humble about it. Like, was I in the top 25? I mean, was I ahead of people?
Yeah, wait a minute. Jerry Seinfeld is lower down than me. Like, I'm doing something right.
Come on.
Oh man, this is not. That's not okay, Paul. But also that you can laugh at that kind of thing means you're not one of these pearl clutching people. When you give us a warning, we should take it seriously. So thank you, Paul. I love you, brother.
Take care.
And until next time.
All right. Bye-bye.